Hey mamas, it's your CajunStork here. What happens when you fail your 1 hour glucose tolerance test? I want to talk to you about what happens when you fail, what the next steps are, and what alternatives you might have to those next steps in today's video. But before I begin, my name is Midwife Kira and I believe in truly natural birth because I know that it makes for better birth experiences. Consider subscribing to my channel and don't forget to join in the conversation in the comments below. And if you look in the description below, you will find a link to my pregnancy complaint kit that I've made just for you. Now, I know that if you're watching this video, you're probably feeling really stressed right now because you may have failed your 1 hour glucose tolerance test. This does not mean you have gestational diabetes. So let's start there. The 1 hour glucose tolerance test is simply a screening test. It lets us know if we need to screen you more for a diagnostic test, which is the 3 hour glucose tolerance test in general. If you fail the 3 hour glucose tolerance test, you are given the diagnosis of gestational diabetes. And even at that point, just so you know, that does not mean that you have to be on medication, but it does typically mean you will have to see a high-risk doctor at some point for a nutrition consult. Now in midwifery care, we do things a little bit different. First of all, when you fail a 1 hour glucose tolerance test, the first thing you should know is what number did you fail it by? Now, typically in a 1 hour glucose tolerance test, there's a range given by your healthcare provider on what a pass or a fail is. If you're 1 point above that range, you fail. If you're 1 point below that range, you pass. As a midwife, that makes no sense to me. I don't believe that gestational diabetes is a yes or a no. It is a continuum. It is a level of sugar intolerance. So by failing your 1 hour GTT as a midwife, I recognize that this means you might have a sugar intolerance, but that does not mean you're diabetic, and we need to take a closer look. Now, depending on the number you got on your test will depend on the next steps. For a mom who severely failed her test, this would be a reading of 140 or above, then what I would do is recommend that she go ahead and take her 3 hour glucose tolerance test. As an alternative though to the 3 hour test, you can actually do 2 weeks of home monitoring with a diet log and a glucometer. Now I have a video on this I'm gonna go ahead and post right here about how to monitor your glucose levels at home in case you're already at that state when you're watching this video. But basically you'll be taking your fasting levels along with either 1 or 2 hour after meals, 3 times a day after meals for 2 weeks. And this lets us know, it gives us like a sneak peek into your diet on whether or not you have good sugar control based on your particular diet. I have had tons of moms fail the 1 hour glucose tolerance test to find out that they're already intuitive enough to know that they don't eat a lot of sugar. They know it makes them feel bad. And when you look at their diet, their glucose levels are cool as a cucumber. No pun intended. Well, maybe a little. So the next steps of either 2 hour monitoring or 3 hour glucose tolerance test are both options. If you failed, let's say by 1 point, 5 points, or 10 points, I strongly encourage my mamas in my practice to go ahead and do 2 weeks of home monitoring first before we put their body through that trial of the 3 hour glucose tolerance test. Why? Well, unlike the 1 hour test, which is 50 grams of sugar, or as you've seen in one of my other videos, is equivalent to like fasting and eating a Snickers bar and drinking a Coke, the 3 hour glucose tolerance test is not 50, but 100 grams of sugar. 100 grams of sugar. That is 16.5 teaspoons of sugar for a woman who is already at risk of actually having gestational diabetes. So in my practice, I really like to reserve this actual test for women that I just truly need to know, and a 2 week home monitoring may not be enough. Now, as a side note, what you should know is if you failed your 1 hour glucose tolerance test with a result of 200 or above, you automatically are given the term or the diagnosis, gestational diabetes, and you will have a consultation with a maternal fetal medicine. This again does not mean you're gonna end up on insulin necessarily. However, I do have to say for my moms who have 200s on their test, they tend to end up on medications. But it does mean that you're gonna need a little bit further evaluation and possibly an extra level of care. Are there any other alternatives to the 3 hour test or 2 weeks of home monitoring? I'm not really familiar with any, and I'm pretty experienced in dealing with gestational diabetes, both as a passion of mine, but also as a midwife who deals with nutrition counseling very often in my practice. And so I'm not really sure that there's any other viable options out there, but if there are, I want you to go ahead and post them in the comments below and I'll do some research on them and maybe post a later video. Do you have any other questions about what happens after you fail the 1-hour GTT or glucose tolerance test? If so, post them in the comments below, but otherwise I'll see you at one of my other Midwife Monday videos up here on the screen. Thanks for watching. Bye-bye.